Hello, my name is Annie Kitsap-Moses, and today I will be talking about how differential reinforcement can be used to treat pica behaviors. People with pica, a behavioral disorder, consume non-food items. I'll go over how differential reinforcement methods, more especially DRA and DRO, can be applied to the treatment of pica in clinical psychology. So let's begin. Pica is a condition in which people consume non-food items such as hair, chalk, or dirt. Pregnant women and children, especially those experiencing food insecurity, are more likely to exhibit this behavior. In actuality, 28% of pregnant women and 5% of school-aged children are impacted. Both intellectual development disorder and autism spectrum disorder are frequently co-occur with pica. Because pica can cause major health problems like poisoning or gastrointestinal problems, it is very important to treat it. Let's now look at the behavioral strategies employed to treat pica. Differential reinforcement is a behavioral technique that reinforces desirable behaviors while decreasing undesirable ones. Differential reinforcement comes in 4 different varieties. Number 1, differential reinforcement of alternative behavior, or DRA, is the process of rewarding a desired behavior while avoiding rewarding an undesirable one. Number 2, reinforcing the absence of an undesirable behavior for a predetermined amount of time is known as DRO, or differential reinforcement of other behavior. Number 3, differential reinforcement of low rates of responding, or DRL, is the process of rewarding a behavior when it happens less frequently. Number 4, reinforcing a behavior that is incompatible with the problematic behavior is known as differential reinforcement of incompatible behavior, or DRI. When it comes to pica, methods like DRA and DRO can be helpful in substituting a more suitable eating habit for pica behavior. DRA, or differential reinforcement of alternative behavior. Eating the right food rather than non-food items is the desired behavior in this situation. Positive reinforcement, like compliments or a small gift, is given to the person each time they decide to eat. DRO, or differential reinforcement of other behavior. In this scenario, the person receives reinforcement each time they refrain from acting in a pica manner. For example, a child may receive a token or praise if they refrain from pica for a predetermined amount of time. The objective is to progressively increase the amount of time without pica. By promoting more acceptable behaviors and eliminating reinforcement for the undesirable behavior, both strategies can help lessen the incidence of pica. I looked at the case study called An Evaluation of Differential Reinforcement in the Treatment of Pica by Colin Muthang, Nathan A. Call, and Seth Clark, published in the year 2020. In this study, 2 children with intellectual disabilities were being treated for pica using differential reinforcement. The method. The children were rewarded for following proper eating habits and refraining from consuming non-food items through the use of DRA in the intervention. Additionally, DRO was used, in which the kids were rewarded for times when they didn't participate in pica. To evaluate generalization, the interventions were used in both clinical and residential settings. The findings. Both children's pica behavior significantly decreased according to the study. Over time, both of the kids started eating more appropriately and their pica behavior decreased. Even with less therapist and caregiver monitoring, this effect maintained. This case study illustrates how differential reinforcement can effectively treat pica and enhance the general well-being of people who are impacted. This is shown by the results of the children in the study. To sum up, differential reinforcement, more especially DRA and DRO, is a useful method for treating pica because it reinforces absent or alternative behaviors. The case study showed how these techniques not only decreased pica, but also produce long-lasting gains. We can lessen the negative behaviors like pica and enhance the general quality of life for those who suffer from this disorder by employing positive reinforcement to promote desired behaviors. I appreciate you for listening to this presentation.